So my condition is heart failure. My medication is Candesartan, 4 milligrams PO. So I can explain the pathology of this disease by saying that heart failure is the inability of the heart to effectively pump blood to body tissues, characterized by impaired functioning of either the right, left, or both ventricles of the heart. It can be either a filling issue or a pumping issue, and this can result in constantly elevated blood pressure, or as a result of constantly elevated blood pressure, pulmonary congestion, or long-term left-sided heart failure, among other things. My top 3 assessments for a patient with this disease will focus on a cardiac assessment, including blood pressure, heart rate, rhythm, and strength, respiratory assessment, the resp rate, rhythm, work of breathing, shortness of breath, and checking for adventitious lung sounds, and also monitoring O2 saturation. And I understand that this medication will treat this disease by reducing blood pressure by blocking the angiotensin II receptor sites on blood vessels, causing dilation of arterioles and veins. Also blocking the angiotensin receptors on the adrenals, causing an increase in renal secretion of sodium and water, all of which will help to reduce the vascular resistance and reduce the workload on the heart, improving the cardiac output. Before administering the medication, I would assess blood pressure, also the heart rate and rhythm. And post-administration, I would also continue to monitor the blood pressure every 4 hours, as well as the heart rate and rhythm every 4 hours as well. The assessment findings that would indicate the drug is working effectively would be a reduction in the blood pressure post-administration, as well as adequate tissue perfusion. Assessment findings that would indicate that the drug is not working effectively would be no change in blood pressure post-administration, as well as persistent signs and symptoms of heart failure. So it could include shortness of breath, cough, adventitious lung sounds, low O2 sats, and peripheral edema. The arrows that I've shown, just to link some ideas, I have so perfusion is a concept closely related to heart failure because it is the inability of the heart to effectively pump blood to body tissues, which would affect perfusion. Also, respiratory assessment would be a priority for someone with heart failure just because left-sided heart failure can result in respiratory changes. I also have the fluid and electrolyte concept as well because the medication works to increase the secretion of sodium and water, which can offset the fluid and electrolyte balances in the body as well. And then also the way that the medication works to reduce the blood pressure, I have links to the assessments to do before administering the medication.